The task of having chemotherapy, or chemo by its short name, can be a daunting one. I prefer to say I am taking chemo instead of I am having chemo, because I can have breakfast or not have breakfast. But if I need to follow my doctor's advice, then I take chemo. Chemo is not something to be feared, and not like it was envisaged years ago as some dark art administered by machine in darkened rooms. In actual fact, chemo is a treatment for sufferers of cancer, and is administered much the same way as a flu jab or taking a tablet. The patient usually sits in a chair, and either a needle is inserted in your hand or arm, and you get a drip feed for a while, or you take tablets, or both. This is my typical pose, either sleeping or thinking. I don't bother going on the computer or phone, as I have developed an ability of sleeping for short periods in cramped places. A throwback from the times when I needed some shut-eye when sailing the seas. Taking chemo is an individual thing. I cannot tell you how it will affect you, nor do I intend to. I give no medical advice or instructions in this video. I'm not a doctor. Only your doctor can tell you what he thinks is possible. The doctor is not there to make you feel better about chemo. The doctor is there to make you better. The chemo is a tool or ingredient in our treatment. My type of treatment this time around, which is not unusual, is a series of intravenous treatments in a 3-week cycle. The first day is the intravenous treatments, followed by 3 weeks of oral tablets. Taking chemo is nothing to be feared, as it involves sitting in an armchair. What are the side effects, I hear you ask? You will get an information pack with each medicine, and if you read them, you will see that there are about 20 side effects for each, and in my case, with 3 medicines, means about 60 possible side effects. Reading a paracetamol leaflet has much the same information. In fact, taking paracetamol for a headache has one side effect: headaches. What do? I don't read them. Instead, I listen to the nurse and I make a note of what she is saying, or ask her to make a note of the things she thinks are worth a phone call. That usually brings the 60 down to about 6. My golden rule is, if it is out of the ordinary for my body, then read or ring. Another golden rule, which I enjoyed immensely, was to eat and build up your body. I suppose the reasoning being that if you build up your body before chemo treatment, then your body has a better chance of fighting the reactions. And in my case, it seems to have worked. So sit back, relax, and have another pie.